Now back to our top story. Governor Gavin Newsom giving an update on California's efforts against the coronavirus and the reopening of our state.
Let's take a listen.
Flowers to families, friends, and loved ones, and notably our mothers in time for Mother's Day this weekend. So this is just an example of what we hope to be seeing replicated all throughout the state of California as we move into what we refer to as the second phase of our meaningful modifications. We're doing so in the retail frame, as well as manufacturing and logistics, and working with counties all across the state of California, almost 24 that have reached out directly to us just in the last 24 hours since yesterday's announcements to begin the process of engaging and dialoguing about regional variants that allow people to move even more quickly into the latter phases of this new order. And that includes in dining establishments, or rather dine-in establishment. It includes a myriad of other functions, offices, and the like. I think it's important for people to know the whole idea is that we will move through phase 2 together as a state. And while we want to see local variation and we want to see counties work with us to move a little bit quicker, we hope to be making announcements on a consistent basis over the next few weeks, moving everybody into this next phase. I know there's deep anxiety people are feeling and desire to reopen, but again, all of this is based on those 6 indicators and our ability to test, to do appropriate tracing, to train a workforce of tracers, to make sure testing is available, not just total numbers in the aggregate, but available in your community on demand, and make sure that the results of those tests come back in real time. We want to be able to protect the most vulnerable Californians all across this state, our seniors, particularly in congregate facilities, homeless that are vulnerable to the spread of this disease, and to make sure that we have hospital capacity, hospital surge, and the ability in real time to do the kind of community surveillance that will allow us to know where the spread is occurring and how we can mitigate that spread and potentially toggle back and potentially strengthen some of these restrictions if indeed we start to see a transmission of this disease beyond our expectations. So all of this in real time, lots of moving parts, but the good news is we are starting to move. I mentioned this yesterday, roughly 70% of the economy in the state of California can open with modifications into this next phase. I know 70% is not 100%, and I deeply recognize with modifications means with restrictions, and with those restrictions means the struggle for businesses to get back to where they were pre-pandemic. And that's why I want us to be sober about this reality. Just because you announce that we have a variation on an opening and people can do curbside pickup and there's a sense that things are moving again, doesn't mean that customers are confident and comfortable yet. Doesn't mean that we are operating with the total number of employees we once were, or the kind of revenue and receipts that businesses were used to. Quite the contrary. And so that is a reality that we all have to work through, and that's why it's so important that we provide supports and we do everything we can to help these businesses get through this moment, not to thrive yet, but to survive and get back on their feet so we get out the other side where they're stronger, more resilient, and more vibrant than ever. So yesterday was a significant day in terms of putting out guidelines. Those guidelines are now being put in effect at Twigs. I saw it firsthand in the back with employees with face masks on, gloves in some respects, making sure that their delivery, their sanitation is up to par. It's a perfect example of what we hope to be seeing more of all across the state of California. Those variations, as I said, as it relates to counties that want to move a little bit sooner, as I said, we've over 20 plus conversations with those counties, and we'll be putting out subsequent guidelines by sector, by industry next Tuesday, which will allow some more clarification, including checklists. We have a new checklist that goes through issues around hand washing, sanitation, how to address the needs of customers through pickups, and how we can make the pickup and drop-off process for deliveries as well as pickups for customers easier and safer, how we can practice social distancing, physical distancing in environments that may be smaller like this or even larger, some of these manufacturing and warehouse spaces. So we try to tailor these guidelines as prescriptive as we can with a frame of flexibility, always recognizing that the entrepreneurial spirit that built this business from a dream to an idea, pen to paper, that entrepreneurial spirit we also want to see advanced as we work through this next phase. And so we want to provide the kind of flexibility that we recognize is important, because no two flower shops are the same. Can be afforded at the local level, and so that's a big part of, again, our advancement and thrust as well. So just wanted to sort of kick this off this day, this momentous day in terms of a meaningful modification of the stay-at-home order, update you on that progress, and wish all of our mothers a happy Mother's Day. I also want to update you on a few other key developments that have occurred in the last 24 hours since we last met yesterday. Because of the number of masks that we're getting in, and this is foundational in terms of moving into the second phase, the ability to provide the face coverings, to provide the personal protective gear for businesses large and small. Today, we're distributing some 2 million masks to farm workers. Today, we're distributing over 500,000 masks to small grocers all across the state of California. Hundreds of thousands of masks in other sectors of our economy are being distributed. We'll be making announcements on a consistent basis of subsequent distribution of PPE outside of just the healthcare system. And yes, we are sending out millions and millions of other masks into the healthcare sector, to our skilled nursing facilities, our assisted living facilities, and into our hospital system as well. We're not neglecting that. We're just substantially enhancing our capacity to deliver a larger quantity of masks because we've been in receipt of a larger quantity of masks. I woke up this morning, 31.7 million procedure masks are now in our inventory. Every day it's growing. Every day we're getting more out, and obviously that demand is significant. But it is a very good sign that we're beginning to turn the corner on PPE. We also are continuing to see good signs on the testing. Over 875,000 tests have been done in the state of California, over 32,000 tests in the last 24 hours. We put out that new testing site. I want to encourage you to take a look at that site. Over 100,000 people have availed themselves to this testing site. COVID-19, covid19.ca.gov, covid19.ca.gov, and you could type in, go to the link around testing, you could type in your zip code, and you can find out the closest, the most proximate testing site. And in the majority of the cases, not every case, there is an online reservation component. We have substantially improved our testing distribution, particularly with OptumServe and with Verily. We still have a lot more work to do. A lot more work to do to address all the testing deserts, but we have made some real progress to do justice to rural concerns and the concerns of Black and brown communities in particular. So again, I hope people take advantage of that site. We want more people tested. It's foundational in these efforts. And as we have noted, the more people tested, and likelihood to see those numbers of positives increase. But there is a rate, and the rate I referenced yesterday is a rate you'll hear a lot about, this case rate. And that's the percentage of people testing positive based upon the total number of people we're testing. And that is one of the foundational numbers, foundational rate that will make our determination of how quickly we can move into the subsequent phases in this pandemic, not just through phase 2, which we're in, but phase 3, and ultimately into that final phase, phase 4, when we go back to events and concerts and large sporting stadiums and arenas and the like. And so we continue to want to remind you, need to remind you of the incredible importance of vigilance at this moment. This pandemic has not gone away. We may be exhausted by it. We may be chomping at the bit to get back to some semblance of normalcy. But we had 1,898 new positive cases yesterday, 1,898 new positive cases. We had 81 individuals and families that were torn apart because of the loss of a loved one. For those that think this emergency is gone, that think this pandemic is behind us, I don't need to remind them of what they see or should be paying attention to when they watch the nightly news, but I hope they're paying attention to these nightly reports that we put out in terms of the total number of lives lost. 81 lives lost because of COVID-19, lives completely torn asunder because of this, not just numbers, not just statistics, human beings and families. And so I extend, again, our condolences to all those families, and I extend caution to other families that think, well, we got this, this is behind us. It's sadly and tragically not. Close to 2,000 more tested positive in the last 24 hours. 81 people lost their lives. So vigilance, data-driven vigilance, health first, data with indicators that determine our next steps, localism, where we recognize variation across the state. Not every part of the state will move at the same time, and that is a very healthy thing because that reinforces our data-driven approach. We would like all parts of the state to move quickly, and that will be determined on our behavior, on physical distancing, on continuing to abide by local health directives, and recognizing that if you're in the Bay Area, those directives do not sadly include today the opening of an establishment for curbside pickup like this. But here in Sacramento, it does. In other parts of the state, it does. And so it's incumbent upon us to recognize that variable, which is regional variability. And we want to give people flexibility, both to loosen quicker and to maintain more strict guidelines based upon conditions on the ground, based on those key indicators. And I want to thank the local health directors in the Bay Area for doing what they think is right for their communities. I want to thank folks down in LA City, LA County, all the respective cities that felt they can move a little bit sooner into this statewide phase. And I want to thank all of those that contacted us that want to move more quickly into the latter part of the second phase. And I want to remind, in closing on this section, everybody, that we will continue to be marching through these phases together. Even if a local variance you can't get now, we're still moving in that direction as a state. And so we continue to see progress. We'll continue to progress through that second phase, even if your region didn't get one of those earlier variances.